Today, the official U.S. death toll from COVID will hit 790,000. Vaccines and masks are widely available, yet nearly 115,000 of those deaths happened in the past 12 weeks. Meanwhile, the Omicron variant has not been detected in Alabama yet. Kenesha Dees has a look from an Alabama epidemiologist on the research they do have so far.
A lot of unknowns still remain with the Omicron variant of the coronavirus. It's now the 5th variant of concern.
So here's what we think. We think it spreads more rapidly than Delta. This is based on the fact that South Africa is seeing a huge surge in cases of COVID, despite the fact that they already battled a Delta wave almost at the same time that Alabama battled a Delta wave.
UAB epidemiologist Dr. Suzanne Judd says that while Omicron may spread more rapidly than Delta, people may get less sick.
We think it's possible. It may be less virulent, which just means less severe. So less likely to put people in the hospital, but still spreading quite rapidly.
She also says in South Africa, pediatric cases are rising, specifically children under the age of 5.
Again, we don't know what that means. It could be because this is so rapidly spreading. It could be because of the time of year. There are many factors, but we think that could be something going on.
Here's what this means for us in Alabama.
Omicron, Delta, whatever the letter that we're calling it, it's still COVID. And what has COVID done to Alabama? Well, last year, for the first time in recorded history, there were more deaths than births in the state of Alabama. We're on pace for the exact same thing to happen in 2021.
Judd says nothing has changed in the fight against COVID.
Vaccination's your best line of strategy to prevent severe infection with coronavirus. Masking is a really good way to prevent the spread when you're out in public spaces, to protect yourself and those around you.
Kenesha Dees, Fox 54 News.